Hello, I'm Patrick Phillips. I'm on the editorial board of Billing and Coding Advantage magazine. We're always looking for thought leaders that can bring you best practices and innovative ideas to help you thrive. It's my pleasure to introduce to you today Dr. Vicki Rackner, a former surgeon and a nationally noted expert in the doctor-patient relationship. She believes the golden age of medicine is not over, it's just beginning. And she's here to share her vision for a more optimistic future.
Thank you, Patrick. If you're a doctor listening to this webinar, you've undoubtedly asked yourself, what's my next step? How will I position myself for success in the era of the Affordable Care Act? I want to welcome you to this webinar. The goal is to give you concrete ideas and tools to help you achieve the personal and professional and financial goals that attracted you to a career in medicine. My name is Dr. Vicki Rackner, president of Medical Bridges. I leverage my experience as a practicing surgeon and clinical faculty at the University of Washington School of Medicine and entrepreneur to help my doctor clients thrive in the era of Obamacare. A dream attracted you to a career in medicine. Here in Seattle, we're all inspired by Russell Wilson and the power of a dream. 2 years ago, he went into the locker room and said to his teammates, somebody is going to win the Super Bowl. Why not us? The game that got us to our second Super Bowl was filled with drama. The first half of the game was a nightmare for us fans. Seattle was not playing like the championship team they are. By the end of the first half, we were behind 16-0. Against all odds, the Seattle champions found a way to prevail. The mood in the general medical community is much like the mood among Seahawks fans at the end of the first half of this championship game. How can doctors possibly live the dream in the face of these overwhelming odds? In our limited time together, I'd like to share my vision about how you can live your dream. I'd like to share with you 3 forces that I see changing the landscape of medicine. I'd like to offer you 5 questions to help you clarify your dream, and then a prescription for success in this post-Google, post-Obamacare era. You'll take away some ideas from my upcoming book, The New Medical Mindset. If I may, I'd like to begin by sharing my own story. I describe myself as an accidental surgeon. I was a graduate student when one day I fainted on my way to the bathroom. I was emergently taken to the operating room in hemorrhagic shock and was found to have an actively bleeding ovarian cyst. Here's my operative note. I woke up in the recovery room just knowing that I would be a doctor and save other people's lives like my own had been saved. I was naturally attracted to a career in surgery, went through a surgical residency here in Seattle, and then set up a private practice. When I was 40, I was blessed to become pregnant with in vitro fertilization. Here's probably the earliest baby picture you've ever seen, my son at an 8-cell stage. I was racked by guilt when my son was diagnosed with broad-spectrum developmental delay. I had operated my whole pregnancy and wondered what had I done to my son. I took a leave from my practice and supported my family by serving as an expert in medical malpractice lawsuits. After about a year, my son was given a clean bill of health, and the question was, what next? Do I return to the operating room? I thought about how an improbable set of circumstances led to our understanding of gastric physiology. Dr. Beaumont was called to tend to a patient who had been shot in the left upper quadrant. He repaired this gentleman's stomach, but thought this patient would die. Instead, the patient lived with a gastrocutaneous fistula. Beaumont recognized the opportunity to study a process that's normally hidden from view. I'd had some unusual experiences. How many people have been a doctor, a patient, a family caregiver? Further, how many people get an opportunity to study cases of healthcare that's gone off track? What if I could call on my own personal experiences to help doctors and patients collaborate more effectively and get better medical outcomes? In 2000, I launched my consulting practice, Medical Bridges. I thought this would be a slam dunk. After all, who doesn't want lower healthcare costs, decreased absenteeism, and the avoidance of untoward outcomes? I thought I'd build it and they would come. I was wrong. I built it, but they didn't come. I kept struggling and trying things that didn't work. Then, one day in Europe, I had an aha moment. I couldn't plug my laptop directly into the wall. Europe was wired differently than the United States. I needed an adapter. I, as a physician, was wired differently than business-minded people. If I wanted to generate revenue, I had to learn how to think like a business person. I invested to acquire knowledge and skills to help me succeed, and I got much different results. Here are a few of them. I've had the honor of delivering keynote addresses at national meetings. I've been the health and wellness expert for a chain of family-owned pharmacies. I'm a contributing expert to a Johnson & Johnson's initiative. Here are some of the places that I've been quoted in the books that I've written. I don't share this with you to boast, but rather to make a point. I was the same person when I was struggling and when I was successful. The difference for me was understanding how to achieve success in a certain environment. What does this have to do with you and your dreams? Well, your environment in which you deliver clinical care is rapidly changing. 30 years ago this year when I began medical school, life was much simpler. The path to success was summarized by my surgical mentor, Dr. John Ryan, when he said it's all about the A's: availability, affability, and ability. When I started my surgical practice, I spent a fair amount of time just taking donuts to primary care doctors' offices to become known and liked and trusted. We live in a radically different post-Google, post-Obamacare world. The pathway to success is changing. I believe that the knowledge and skills and tools that I've accumulated over the past 15 years may contribute to your ability to achieve your dream. Let's dig in and talk about the three forces that are driving changes in the landscape of healthcare delivery. Let's begin with the breathtaking rate of medical innovation. Medical historians believe that George Washington died of epiglottitis. He was treated with state-of-the-art care at the time, bleeding and purging. When his airway was compromised, one of the young physicians trained at Hopkins had suggested a tracheotomy. However, that was dismissed as experimental treatment. We had different beliefs about what was safe and unsafe. A friend of mine, a 70-year-old nurse, talks about the early days of her career when an OB yelled at her. He said, "Can't you understand? What I want to do is walk on the ward with a lit cigarette, put it in the ashtray, deliver the baby, come out and finish my cigarette." The evolution of cholecystectomy reflects a general trend: minimally invasive, faster, more easily tolerated by patients. Let's take a look at the history of dental health. When George Washington was sworn into office, he had one natural tooth in his mouth. My dentist started his dental practice in 1959 and told me that he spent about half of his time making and repairing dentures. He also tells me that a child born today has a good chance of never having a single cavity in his life. What if we could do that with overall physical health? We've seen a revolution in patients' access to medical information and medical care. Doctors used to be the gatekeepers for all things medical. Now it's a rare patient who doesn't consult with Dr. Google. Patients have access to diagnostic tests and therapeutic interventions. Last year, almost 1 million Americans left the U.S. to seek medical care abroad. We're seeing a trend in the direction of increasing transparency. Patients have access to data about medical outcomes. They might know, for example, that Seattle is a good place to have a heart attack. You have about twice the chance of surviving here as you do in any other American city. Like it or not, patients are sharing their experience with you on many different platforms. Who would have imagined that one day Medicare would release its data about payments to individual physicians? Patients care more and more about healthcare costs. They have more financial skin in the game, and it's getting easier for them to compare services and cost and value. In the language of the real estate industry, we're in transition from a seller's market to a buyer's market. What if, in the very near future, patients make choices about healthcare the same way they make choices about air travel? The doctor, like the pilot, is largely involved in the safe arrival at a given destination. However, when was the last time you chose your airline ticket on the basis of who was flying the plane? In your eyes, you just assumed that every pilot can get you to your destination safely. You most likely booked your last flight on the basis of cost and the experience with the airline and maybe a loyalty program. What if in the very near future the same kinds of considerations guided patients' health care choices? The things that are important to patients can be different than the things that are important to doctors. I was involved with a consulting project to decrease the incidence of chemotherapy-induced nausea and vomiting. The organization first surveyed oncologists and their patients, asking the question, is chemotherapy-induced nausea and vomiting a problem? 20% of the oncologists said yes. 80% of the patients said yes. Why the disconnect? It could be that in the patient's mind, the doctor's job is to rid them of cancer cells. Asking for treatment for nausea and vomiting could be like asking a pilot for a drink of water. They just don't consider doing it. Put yourself in the shoes of a patient. Let's say you had the choice of going to hospital X or hospital Y. If you knew that Hospital Y went above and beyond to make sure that you were comfortable during your treatment, where would you go? Then there's the elephant in the room, the most sweeping healthcare reform since 1965 when LBJ signed Medicare into law, the Affordable Care Act. I think we agree that we all want to live and practice medicine in a country where every American has access to healthcare. The problem is expense. How are we going to pay for this? Experts currently project that the Affordable Care Act will cost the American citizens between $1 and $2.5 trillion. How will we pay for that? Here's how the government answers. We'll avoid high-cost healthcare services. When people are insured, they'll avoid the emergency room. The data's not in on that. There will be higher taxes. And of course, according to the U.S. Department of Labor statistics, 9 out of 10 of the top earners in the U.S. are doctors. So you will be paying higher taxes. Further, businesses will be paying higher taxes, so the cost of goods and services for you to run your medical practice is going to increase. The government argues that we'll decrease costs by increasing efficiencies. Of course, what that means is that you, doctor, are expected to make an investment in the infrastructure, so your costs are going up. The last way that we're going to pay for this is with what the government calls spending cuts. What that means for you are fee cuts. You know that the 33% Medicare fee cut is just around the corner. And you also know that as Medicare goes, so too go the rest of the insurance companies. So you are looking at some acute financial pain. You're seeing falling reimbursement and rising costs. And this is the cause of despair. We're facing a solvency problem. We're already seeing trends. Physicians are selling practices. In the 1980s, about 80% of physicians had an ownership stake in the practice. After managed care, that number dropped down to 50%. Today, it's 40%. It's projected that in the years to come, only 1 in 3 physicians will have an ownership stake in the practice. We're seeing physicians seek new revenue sources. We're taking a look at more non-traditional practice models like concierge medicine or all-cash practices. And we're seeing doctors looking at retirement in a different way. The sad truth is that few physicians are able to translate their high earnings into high net worth. According to this recent AMA Insurance Agency study, about half of physicians were behind where they'd like to be in retirement planning. We physicians and doctors as a group have a low financial literacy, and we're paying the cost, quite literally. Despite these changes, one factor remains universally true. The foundation of our healthcare system is a relationship between a doctor and a patient. Regardless of the economic or political climate, the rewards from this relationship will always be there. The doctors poised for success practice what I call medical martial arts. They go with the momentum of the changes instead of fighting them. Here are 5 questions I learned to ask as I made my transition from a clinician to an author and speaker and consultant. Question number 1, whom do you serve? Think of yourself as a change agent. Who changes as a result of having contact with you? Let's call that person your client. Traditionally, this is the patient. Question number 2, what outcome do you help your client achieve? And let's call that transformation the result. Now we know that people pay for results. They pay to get from point A to point B. Number 3, who signs your check? How do you get paid? Let's call that person the buyer. Question number 4, what does the buyer value? In the world of business, people exchange money for things that they value. Value, like beauty, is in the eyes of the beholder. You may know things that you think patients should value, but what does the buyer actually value? Question number 5 is, how do you deliver more value? If you want to generate more income, the way to do that is to deliver more value. Let's take a look at the 3 most common ways that doctors operate. The first is the physician in private practice. The client is the patient. The result is to diagnose and treat illness. The buyer is the insurance company. And what does the insurance company value? Increased profits. Let's take a look at the employed physician. Their client is the patient. Again, they're there to diagnose and treat illness. Their buyer, the person who signs their check, is the employer. And of course, in order for the hospital to remain open, they need to be profitable. Third, there are physician executives. Their client, The people that they want to influence are largely the medical staff. The result they're trying to achieve is the delivery of quality health care. The buyer, the people to whom they report, is usually the hospital board. And again, the hospital needs to be profitable in order to stay open. Let's take a look at some emerging models. There are doctors who are going to a concierge practice or an all-cash practice. The major difference is that the patient is the buyer. You don't have complex triangulated relationships in which different people want different things. Let's say you're a medical inventor. You create a medical app. Well, again, your buyer and your client are the same. Your ability to understand what your client values determines your profitability. Let's say you're a doctor who's created a weight loss system or a smoking cessation system. You might want to sell a package to either your patients or healthcare consumers at large. If you have some true value, if you really are able to offer a transformation, patients are willing to pay for this. Most doctors push back the first time they're exposed to these ideas. They say, Vicki, I can't even get patients to pay my copay. How am I going to turn to them for payment? And I'm here to tell you that patients will spend money to achieve the results that they value. And here's the evidence. In the midst of the Great Recession, Americans spent $80 billion out of pocket on anti-aging products, $60 billion on weight loss products, and $28 billion on supplements. The key is offering something that your buyer truly wants. Successful doctors who adopt a new medical mindset understand that their value transcends their ability to make a diagnosis or treat an individual patient. They help their buyers achieve their desired outcomes. When I started my surgical practice, my buyer was the insurance company. Now, anybody with a checkbook can potentially be your buyer. It was pretty easy to determine my income. It was a function of the diagnostic and procedure codes I submitted to the insurance companies, which insurance companies, and how many patients for each. Now things are different. Your fee is tied to your perceived value, and your buyer may or may not be the insurance company. Let's translate these abstract ideas into concrete action plans. Here are 7 ways that you can generate more revenue starting today. The first is serving as an expert in medical malpractice lawsuits. This is something that you can do on your own schedule. You can generate significant income. Plus, I think it made me a better doctor. Next, you could sell products or services that align with the clinical goals that you and your patients have developed. When I take my pets in for their exams, the vet offers books and all sorts of tools to help support my goal as a responsible pet owner. If you're a cardiologist, could you make it easier for patients to eat more healthfully or get exercise? If you run a busy practice, maybe you want to think about having an in-house formulary that will both increase compliance and add to your bottom line. You might want to revisit the scope of your clinical services. Think about the Shouldice Clinic. They do one operation and get such great results that people come from all around the world to get their medical care there. I know a dentist who specializes in phobic patients. Could you specialize? Could you be a destination for medical tourism? Maybe you want to get involved with telemedicine, which is travel medicine without the travel. If you enjoy speaking, there are opportunities educating and empowering and entertaining healthcare consumers or even your colleagues. I can tell you that I generate as much giving a 1-hour keynote as I did in the most complex surgical case that I performed as a practicing surgeon. What about the possibility of coaching or consulting others to achieve the kinds of results that you have? Do you have any interest in stepping up as a leader, either as an elected official, maybe as part of the hospital staff, or maybe in the business community? Stephen Covey defines a leader as somebody who's able to articulate to others their value so clearly that they come to see it for themselves. You may want to look at non-medical ways to generate revenue. I remember being part of a conversation on Doximity about non-clinical careers, and one doctor said, go into real estate. Really, there's great opportunities there. What you want to be very careful about is to avoid what one of my clients calls DDDs, dumb doctor deals. We've all been there. We hear about this great investment opportunity in the doctor's dining room or surgeon's lounge and wind up losing money. Only about half of physicians are partnered with a financial advisor. The ones who are partnered with an advisor generally do better financially. That would be a good person to vet these kinds of opportunities. With all of these options, how do you decide what's right for you? Here are 4 questions that may help you with your reinvention. The first question is, what do you really enjoy doing? As you look at your appointment book, is there a certain kind of patient that you get excited about seeing? Is there a certain kind of problem that you really enjoy solving? What are your gifts? What do you do effortlessly? You can ask your friends and colleagues, if I were on a magazine cover, what magazine would it be and what would the story be about? Or you can ask your friends, if you could only call one person, under what circumstances would you call me? Next question is, how do you improve the condition of others? Of course, you help your patients achieve medical goals, but is there something beyond that? I have the privilege of reviewing a manuscript of a book from cardiothoracic surgeon Dr. Lester Savage. He said before he operated on a patient, he would always ask them, why do you want to live longer? And his true reward was the spiritual awakening that he saw in his patients. The next question is, how would you like to be remembered? What kind of legacy would you like to leave? The question after that is, does your appointment book reflect that? The next question is, what does wealth mean for me? I know when people are looking at retirement, they want to know their number. How much do they have to have in assets before they can retire? I think about wealth as the freedom to do what you want to do when you want to do it. What does wealth mean to you? And how much income do you have to generate in order to achieve your vision of wealth? In the world of business, your income is related to your impact. What impact would you like to make? We used to joke that the whole world is pre-op. Now that is quite literally the case. You could impact the lives of millions of people by doing the things that you love to do and get paid well for it. The prescription for success is simple. Be who you are, know what you know, and do what you need to do. Some say the golden age of medicine is over. I disagree. I believe that the golden age of medicine is just beginning. Dream big, because big dreams really can come true. Thank you so much for your time and your attention. I hope that you found value in this content. If you'd like to do a deeper dive and really explore how you can create work that works for you, I invite you to learn more about the Doctors Thrive Virtual Bootcamp. Through 6 live web-based sessions, participants go through a proven system that will help identify the career path that works best for them. As a special bonus, people who sign up this week will also get access to a special media toolkit with the information that's helped me get quoted in national publications. To learn more, please visit www.medicalbridges.com, and thanks again.